Okay, this is pancreatic cancer. Introduction. So, pancreatic cancer is caused by uncontrollable replication of abnormal cells, and it is one of the most deadliest types of cancer. It is caused by specific gene mutations that prevent unhealthy cells from growing through apoptosis or programmed cell death, and the main gene mutations occur in the KRAS, TP53, CDKN2A, and SMAD4 mutations. In Figure 1, you can see the percentages next to the gene names that shows like how common they are. And in Figure 2, you can see the normal versus abnormal cell cycle. There's the rapid cell growth of an abnormal cell in the abnormal cell cycle. And in Figure 3, you can see the cell cycle itself, interphase mitosis, and cytokinesis. Alright, so the KRAS gene mutation is basically affects the KRAS gene, and this gene codes for a protein that relays signals from outside of the cell to the nucleus, and it influences cell growth and division, and affects the G1 checkpoint in the cell cycle. Missense mutations basically change one amino acid, and this is what happens in the mutation for a KRAS gene. And it can stimulate cell proliferation and even suppress apoptosis. These cells can then also support tumor progression through certain regulations, and the mutation in this gene causes the loss of function in the KRAS protein, and the cell does not receive signals for apoptosis or that it is unhealthy. So in Figure 4, you can see mutations in the KRAS gene in the RAS exon, the RAS family. Okay, TP53 gene mutation. So, in the cell cycle, this TP53 gene encodes a crucial tumor suppressor that regulates cell growth, division, and death, and responding to it responds to cellular stress and DNA damage. So it codes for the P53 protein and is a missense mutation, and it causes a loss of function in the protein. So this protein usually functions at the G1 and G2 checkpoints, and it makes cells go through apoptosis or cell cycle arrest, meaning it makes the cell exit the cell cycle. However, the mutation causes a loss of function in the protein, and unhealthy cells end up going through the cell cycle and replicating. So this is the CDKN2A gene mutation. So this usually codes for P14 and P16 proteins. However, in the most common mutations, the P16 protein is most commonly affected. The P16 protein regulates cell growth, especially in the G1 checkpoint. And these proteins are regulators of cell proliferation. And the CDKN2A is a tumor suppressor gene. So the mutation in this gene causes a loss of function in the P16 protein, and the protein is unable to regulate the cells at the checkpoints, so unhealthy cells slip by the checkpoints and go through the cell cycle. And in Figure 6, you can see the mutations in the CDKN2A gene. Alright, so now the SMAD4 gene mutation. So this is the fourth major gene mutation that drives pancreatic cancer. So the SMAD4 gene codes for the SMAD4 protein, and it acts as a mediator between growth factors from outside the cell and genes inside the cell nucleus. So the protein basically relays the signal from outside the cell to the nucleus through the TGF-beta signaling pathway. And the protein is crucial to send messages to the cell for apoptosis or cell cycle arrest. And it is a missense mutation when the protein loses function, and unhealthy cells do not receive the message, and they keep going through the cell cycle, replicating uncontrollably. In Figure 7, you can see the mutations in the SMAD4 gene.
Some of the symptoms of pancreatic cancer include jaundice, which is the yellowing of the skin and the eyes, It is painless in pancreatic cancer, and it is also unique as it's the only cancer that includes this symptom. Another part that accompanies with jaundice is dark urine, which turns the urine to a dark color, and it is also unique to pancreatic cancer. Some other symptoms include belly pain, which is pain in the upper abdominal and the backside, which causes pain whenever you sit down or lie down. Lastly, another symptom is diabetes, which, if you are recently diagnosed or was currently diagnosed, it will be harder to control. So some risk factors of pancreatic cancer includes age. So the more older one is, the more likely they are to be diagnosed with pancreatic cancer around the average of age 70. So your race also matters, as if you are African American, you are more likely to be diagnosed with pancreatic cancer. Gender, men used to be 30% more likely to obtain pancreatic cancer, but now it is around the same for both men and women. Smoking is a huge part of pancreatic cancer, as 20% to 30% of all pancreatic cancer cases have resulted from smoking. And alcohol, though not directly causing pancreatic cancer, can result in chronic pancreatitis, and it is more likely to have the cancer. Lastly, some toxins in the air that might affect your chances of getting pancreatic cancer are pesticides, asbestos, and nickels, as they increase your chance of being diagnosed.
Now we move on to our global distribution. Pancreatic cancer cases are more common among older individuals, men, and African Americans. Cases are also often found in Western Europe due to their smoking and low rates of physical activity, North America due to a high amount of smoking and a high amount of alcohol consumption, Hungary, as you can see in Central Europe, due to an insufficient intake of fruits and vegetables, Uruguay, as you can see in South America, due to a major diet of red meat, and lastly, Japan, as you can see in Eastern Asia, due to the high animal fat consumption rate. Next, we move on to our different treatment options. The most common treatment option for pancreatic cancer is the Whipple procedure. The Whipple procedure is a type of surgery where the doctor removes the head of the pancreas, where the tumor is, part of the small intestine, part of the bile duct, along with the gallbladder. As you can see in the image in the top right, this is a simple outline of what the Whipple procedure actually does. The top is a before surgery image and the bottom is an after surgery image. As you can see in the bottom part of the image, after the Whipple procedure is completed, we are only left with part of the bile duct, part of the pancreas, part of the small intestine, and the stomach. Next, we move on to a more common treatment among cancers, radiation therapy. Radiation therapy uses high energy beams to destroy cancer cells. If you want to use it before surgery, you would use it to shrink some tumors. And if you want to use it after surgery, you would use it to kill any remaining cancer cells that weren't taken out from surgery. As you can see in the image in the bottom right, this is a basic animated image of what radiation therapy actually looks like. A machine shines radiation onto your body and your pancreas to kill and reduce any tumors or cancer cells. Next, we have our different methods for screening to see how you actually know if you have pancreatic cancer or not. The most common is an MRI. This uses a strong magnet to take pictures of the body. We also have an MRCP, which uses the MRI to see the liver, gallbladder, bile ducts, and pancreas. Next, we have our endoscopic ultrasound and EUS to see detailed views of the pancreas and biliary system. And lastly, we have a most common way, blood tests. Blood tests in pancreatic cancer help identify any potential markers that an individual may have pancreatic cancer.
Some clinical trials for the pancreatic cancer would be the neoantigen vaccine and the fecal pill. The neoantigen vaccine had clinical trial testing which personalized neoantigen peptide vaccines for safety and prognostic impact, and it was studied by a group of scientists led by Vinod Balachandran. The hypothesis that they were able to come up with so far was that these vaccines are safe and trigger measurable neoantigen specific immune responses. The fecal pill was an experimental oral capsule, also referred to as LND101, made from healthy human gut bacteria or poop. This pill aims to boost immune response and improve chemoeffectiveness in pancreatic cancer patients, and these trials were led by the Verspeden Family Cancer Center located in Canada. Some fun facts about pancreatic cancer is that pancreatic cancer is actually referred to as a silent killer because symptoms often don't appear until the cancer is more advanced. And the pancreas is also considered hidden in your body, as the pancreas is about the size of a banana and it hides behind your stomach, making tumors harder to detect in earlier stages. And pancreatic cancer actually has quite a large impact because despite being the 10th most common cancer, it's the third leading cause of cancer-related death in the US. And finally, these are the citations of the sources we used.